Good. Can I see a virtual raise of hand? If you have not studied science, that means biology, in your 11th or 12th, you're not, you have not studied science. I know a lot of us studied, but we forgot. But I'm asking if you're not studied. Okay, so all of you have studied science, right? So good. So I made my effort, right, to kind of simplify. Even if you have your son or daughter who is studying high school can understand. That's my effort, right? I hope I'll be able to live up to that expectation, right? So let's dive in. I'll be sharing few slides, right? So let's kickstart. If you are ready, can you message I'm ready? Yes, let's start. If you're ready, yes, can you message? I need some energy. If you can smile at me, right? So I've got two things to cover. One, we'll talk about gut health and how it is related to autoimmune conditions that we come across, and what is this undigested protein, right? How it can turn against us, right? That's the summary of what I'm going to cover. So let's dive in, right? So we have a 3.5-year-old daughter. If we ask her, hey, can you show me where is your nose? She'll show like this. Ear, she'll show like this. Hand, she'll show like this. So do you know where is the gut in our body? How about messaging? If you can message, where is the gut in our body? Very basic, right? So we talk about gut, right? A lot of things. We talk about gut feeling as well, right? So where is the gut in our body? Message. Don't worry. Okay. Stomach. All right. Abdomen, intestine. All right. Right. In fact, it's a very complex system. Gut cannot be coined as an organ itself, right? It communicates with so many other things. It's a system by itself, right? We have immune system, lymphatic system, the entire this gastrointestinal tract, what we call, starting from your mouth until anus, right? So what you see in this colorful picture, right? Apart from liver and pancreas, everything belongs to gut, right? What we call as gastrointestinal tract. So it's not, you cannot pinpoint and say it's starting from mouth to the anus. So that is a little background about gut. So now let's understand what is microbiome. Where are these present, right? In fact, in our body, there are trillions of microbes present inside our body. They're living inside our body. It could be bacteria, virus, fungi, parasites, lot many. If you look at the number, it's trillions. And this number exceeds the number of cells that human beings have. So we have more of microbes than human being itself, right? So we have different microbiome, different colonies of these microbes present in our body, starting with your mouth, right? Your lung, your breast, your skin, right? In fact, whenever a baby is breastfed, right, a good microbiome gets into the baby's gut. That's how you build a healthy gut in a newborn baby, right? So it's wide. So we're going to stick to one thing called gut microbiome. That's what I'm going to dive deeper. And I gave a perspective of what we're going to discuss into, right? So what is the composition of this gut microbiome? We talked about trillions of microbes. If I have to draw a chart, 90% of our gut microbiome is bacteria, right? And the rest 10% is other microbes, right? So that means we have more bacteria in our gut. So interesting question. Do you know the name of the first bacteria that existed in our body from a very long time? I'm talking about very, very long time. Any wild guesses if you can message? Wild guess. That means we've been living with bacteria for many, many years. What is the first bacteria that ever existed in our body? Okay, E. coli. I think someone answered right already, right? It is called mitochondrion. In fact, our human cell has a lot of mitochondrion. So together it's called mitochondria, right? So what little bit of story, right? To set the context, right? It's been 2 billion years, right? Our ancestor human cell literally ate a bacteria live, right? And it became part of the human cell since then. And they have been living together so symbiotically, right? And they have a mutual agreement. The human cell said, I'll give you food, you give me energy. The whole purpose of mitochondria in our body, right, is to give energy to us. So every food that you eat, your bacteria is actually getting converted that food into energy, and that bacteria is your mitochondria. It has become part of our life as well. With this context, I'd like to switch over to gut microbiota, gut microbiome, right? So now, in fact, a mitochondria pay a rent by giving us energy for human cells to thrive. Similarly, our gut microbiota, which has 90%, means trillions of bacteria present in our gut microbiome, pay us rent by producing something called as metabolites. Don't worry about this technical term. So metabolites is basically, if I showed you this, mitochondria provides you energy, right? When you give food, your gut bacteria gives you something called as metabolites. So these are very useful things that are required for us. It helps in our holistic health. How does it happen? So when we eat food, especially the dietary fiber that is good in nutrition, when we eat that food, it goes through a fermentation in our small intestine and large intestine. So that process is called fermentation, right? When you have a good bacteria in your intestine, the fermentation start producing something called as short chain fatty acids, right? So it's a component that our body produces, and it has different varieties. One of that is acetate, propionate, butyrate. Don't worry. So it's basically very helpful. How is it going to be very helpful? Just to talk about one, right? How many of you have been hearing a lot of news and stories how a lot of people from Bollywood and Hollywood have been losing weight, and they've been using a medicine? Anybody who remembers what is that medicine? I mean, a lot of people talk about, right? There are a lot of reels being made, pros and cons. So anybody remember it starts with O? A lot of Bollywood actors have been losing weight because of consuming. So it's debatable whether it is safe or not safe. Yeah, absolutely. It's called Ozempic. It's a medicine. Right? How about if I tell you, I can give you a natural equivalent of that? That is your short chain fatty acid. So this short chain fatty acid gives you a very good appetite regulating hormone called GLP-1. Right? This is what regulates your appetite. In fact, when you're hungry, you tend to eat food, right? So this hormone basically helps you not to become hungry. It uses existing resources in your body to give you energy. That is how it regulates your appetite. And it delays the process of some part of bowel movement so that you will be able to get the nourishment even in your when your stools are in your bowel, right? So that is one of the effect of having a short chain fatty acids, right, in your gut. And what provides that? When you consume salads, when you consume fiber rich dietary food, your short chain fatty acid shoots up and will help you to regulate a lot of things. In fact, it helps you regulate your blood sugar levels as well. It will help you kind of regulate your energy and resource mobilization, taking energy from your muscle mass and providing you energy whenever you need it. And also helps you in stop building your body fat, what we call as lipogenesis. In fact, whatever we eat food, the food is getting converted into carbohydrate, but if you're not utilizing it, that is what it gets converted into triglyceride and the body fat, right? It regulates that process as well. It stops a while for a better usage of the resources, right? So your gut microbiota is paying you back all these beneficiary metabolites. One of that is short chain fatty acids. So your gut plays a significant role in a lot of aspects. If you're looking for weight management, if you're looking for good health, a lot of aspects, gut plays a significant role, right? No, we all learned, right? So when you attended expert talk, so we all learned what is a function of our immune system, right? What is a function? Can you message? What is the function of our immune system? What is it supposed to do, right? So what is it supposed to do? Yeah, it fights against infection, protect, defense system, right? Identifies the intruder, right? So in fact, if we have trillions of microbes within our body, right? So why our immune system doesn't destroy it? It's an interesting question, right? So if our immune system is designed to destroy the microbes, so why doesn't it destroy? This is very interesting to understand, right? Don't worry about this complex diagram. There are two things that you have to focus, right? I talked about a microbiome, right, towards your right, and we talked about gut microbiome, and we have an immune system. It's a complicated system. This is a system that consists of lot of organs, lot of things. All your white blood cells which fight against your infection is part of this entire immune system. And one of the organ called Peyer's patch, it is part of the immune system. We have 30 to 40 Peyer's patches all across our small intestine. So this Peyer's patch is responsible for training your immune system. It basically acts as a training ground to train the immune system, right? It identifies what is good, what is bad, what is a pathogen, what is a good bacteria, how beneficial it is, whether to destroy or not to destroy. This entire design is encoded in every DNA of ours. So Peyer's patch will be able to train, evolve the immune system, right? When the baby is born, only innate immune system is active, right? When baby starts getting mother's breast milk, that is where it starts training certain good and bad bacteria that comes through that, right? So Peyer's patch plays a very significant role in ensuring it doesn't destroy your gut bacteria. That's why we have trillions of them still present, because we have a symbiotic relationship with those bacteria. So it's very crucial. It acts as functional tuning. It fine tunes, making sure your bacteria, which is good for you, has not been destroyed, right? So let's change gears. Now we understood, right, how the gut behaves, what are microbes, what are its role. Now, how gut health, if you don't have a good gut health, how does it trigger autoimmune condition? In fact, there's a lot of research done. If your gut is not healthy, every other biomarker in your blood report, every other problems that you come across is directly linked to gut. I mean, there are a lot of the one area that is extensively researched is gut health nowadays, right? So how is it impacting autoimmune condition, right? What is the definition of autoimmune condition? So we learned about immune system trying to attack a defender, right? What happens sometimes our immune system start attacking our own healthy cells. It could be part of your thyroid, it could be part of your skin, it could be part of your pancreas. So why does that happen? Why does our own immune system, if it is so smart, as we said, to detect a good bacteria from a not good bacteria, why is it not smart enough to identify this element and why it is attacking us? When it starts attacking us, it is horrible attack. And people will experience a lot of different things when they're going through autoimmune condition. But the problem with autoimmune condition is you'll not be able to kind of pinpoint. The diagnosis itself will take more than 4 or 5 years to diagnose that you have an autoimmune condition. And the symptoms are so common, so wider. So that's why it's very difficult to diagnose as well. Right? So let's dive in. So what triggers autoimmune condition when you have a gut issue, right? So this is a cross section of your gut. As I said, it's a very lengthy system. It's like the length of a tennis court. That's what your gut is, right? I've taken a cross section of that, right? If you look at, if I start from the bottom, right? So you have a blood that is circulating. That is part of your gut lining as well. It is tightly in communication with your gut line, right? And you start noticing a tight junction, right? This is your cells, right? I hope you know our body has trillions of cells as well, right? This is something called as mucosal membrane cells. They are tight. There is no gap in between. If you start noticing there is a gap here, right? There's a red arrow mark. There's a gap here, right? This is what we call as a leaky gut, right? So this leaky gut is a trigger for your autoimmune condition. So what triggers it? Why will you have a leaky gut? Right? There are a lot of factors to it, right? You cannot pinpoint a one factor. That is how holistic living plays a significant role. Your stress can induce a leaky gut. The toxins, the environment toxins that are surrounding can start pricking your leaky gut. Your food allergies and your high blood sugar levels can also trigger. And your antibiotics is the number one culprit destroying your healthy gut. And your stomach acid being low and food not being digested, it is getting fermented, rotten, that can also trigger leaky gut, right? So when there is a leaky gut, lot of things start leaking into your bloodstream. This is the problem. If you have a healthy gut, if there is no leakage happening, even an undigested protein will just pass away through your stool. It will not impact too much unless you have complications of celiac disease and IBD. Apart from these, there's no complexion whatsoever in case of autoimmune. So when there is a leaky gut, especially your gluten, what is gluten? It is a protein component of wheat, barley, rye, even quinoa, some part of quinoa. So these gluten molecules, body doesn't digest properly. So when this undigested protein molecule called gluten enters into your bloodstream, it creates a havoc. Your body start behaving very weird, right? Now let's understand what happens, why this autoimmune gets triggered when undigested protein. I'm just giving an example of gluten. It can also be a milk-based dairy protein. It could be casein. It could be lectins from your pulses, right? It could be any undigested protein triggers your autoimmune condition, right? So what happens? What happens exactly when it enters into a bloodstream, right? So I've tried to put it more of cartoonistic pictures here so that you can understand better. Please stay with me. Can I have your attention? This is crucial to understand, right? We talked about, we have a healthy cells and this gluten comes inside our bloodstream, right? Our innate system is your first line of defense. Any intruder that comes, any virus, any bacteria, any foreign substance. In fact, our body starts treating gluten as a foreign substance and it gets activated. Hey, I detect a threat here and I want to destroy gluten. And your innate immune system destroys the gluten. It carries something called as antigen. So what is an antigen? Antigen is basically a part of your destroyed invader. In this case, it is gluten. The pink color thing that your innate system is holding in the hand is your antigen. So why it carries that antigen? It sees a lot of gluten present in the system. With innate system, you'll not be able to destroy all the gluten. That's why it goes and calls something called adaptive immune system, which is powerful, which has powerful weapons. And your T cell and B cell are part of that adaptive immune system, which is very powerful, which can kill multiple number of glutens in one go. So how does that system get activated? The moment your innate system presents an antigen, there are specific adaptive system for an antigen. Every antigen, every invader that attacks our body will have a specific T cell and a B cell. Once that is activated, it multiplies itself. One T cell can become thousands of T cells. One B cell can become thousands of B cells. Each of them have their own rules. So that is how your adaptive immune system comes and start attacking an invader. In this case, it is gluten, right? So now The role of B cell, which is adaptive, right? It produces something called as antibodies. The whole goal of antibodies is to tag an invader cell, which is very harmful. It just tags, it just marks. Hey, how does it mark? It identifies a corresponding antigen. The pink dots that you see on these gluten cells, the pink dots are your antigen, right? And it goes, the antibodies goes and tags those antigen. And they just said the whole purpose of B cell is to tag, right? It will not kill. It will just tag them and presents it to other immune cells. It helps other immune cells to kill it, right? Then your T cells and other part of immune system comes and kills. So now what happens? This is very interesting, right? Your adaptive immune system, the role is to tag for a matching antigen. It doesn't care. The problem is some of our healthy cells, it could be your thyroid, it could be your pancreas, it could be your skin. Some part of your cell is a protein peptide, right? That can have an exact similar composition of an antigen of a gluten. That means, in a layman term, your gluten has a pink spot that is an antigen. Some of your cells can potentially have that pink spot, pink dots. B cell doesn't care. All it looks for is that pink dot, and it sends the antibodies to mark your cells for destruction. And that is how your immune system, the adaptive immune system, T cells, there are a lot of other part of your immune system comes and start destroying gluten. At the same time, it also start destroying your healthy cell. This is where the problem happens. This is what triggers Hashimoto's. When you have thyroid antibodies being generated and your B cell start marking your own thyroid tissues for destruction, and your immune cell attacking your thyroid and impacting your entire thyroid system, and you have an elevated TSH. Sometimes it will not, I mean, a lot of diagnosis when I have come across, it will not even show you. It shows your normal TSH, it shows your normal T3, it shows your normal T4, but you have symptoms. When you do your antibody test, it is in the initial phase of destroying your thyroid hormone. I mean, I'm not against any medical professionals here, but the diagnosis only they limit themselves to measuring TSH, T3, and T4. I would recommend, if you have any thyroid problem, you have to measure your antibodies to understand whether your thyroid is caused by autoimmune case or if it is something else. Something else could be deficiencies. So when you take thyronorm, you're trying to fix the symptoms. You're not trying to fix the root cause. Your thyroid is still under destruction, but you're taking a thyronorm, which will still provide you thyroid hormones, but your organ is still going through the destruction of autoimmune case. One day you'll experience the thyroid organ is gone. That's where you see people where the dosage is being increased over a period of time to fulfill that gap. And a lot of people eventually has to operate thyroid and remove as well. And I've come across a lot of cases where people don't have thyroid organ, but they still be able to function because of thyroid. You just have to visualize this can happen to any other cell in your body. If it happens in pancreas, that's where a type 1 diabetes comes. So type 1 diabetes is more of genetic molecular mimicry. It happens very young, at the age of 2, 3. Just had a discussion with a 5-year-old child struggling with type 1 diabetes. It's more of genetical susceptibility. But when it happens after some time, when it happens in your teenage, when it happens in your 20s and 30s, that is triggered by your autoimmune condition, right? So now, why is our immune system is not smart enough to regulate this? Why is it not stopping our healthy cell destruction? There's something called as regulatory cell, T regulatory cell, part of your innate immune system, which instructs T cells to stop destroying a healthy cell. And that is how it subsides your immune system not to destroy. It is like regulating your active immune system to reduce the kill. The problem is the T regulatory cell is present and generated in your gut. 70% of our immune system is regulated through gut. The Peyer's patch is responsible for regulation. And if your gut is not healthy, and if you're not having enough T regulatory cells, there is no one to control. The role of T cell is to destroy. And it goes and destroys. That's all it does. Right? Now you might be wondering, so if gluten is a problem, our parents, grandparents, our ancestors have been eating wheat. In fact, wheat has a history of more than 10,000 years. Right? Should we stop eating wheat now? If I have to kind of answer to this very honestly, right? You don't have to do anything right now, unless and until you're experiencing any of those symptoms. The first thing that you should do is you do your blood test, all the tests, any of the biomarkers all over the place. If you have an inflammation in the body, if you have thyroid, then you can start checking your antibodies. If you don't have any symptoms, it's absolutely fine. See, gluten in your gut is not a problem. It might damage, in case of celiac and IBD diseases, some part of gut lining, but our immune system is smart enough, right, to kind of help you heal the damage. But you're consistently exposing your gut for a lot of junk. If you look at the amount of gluten that we are consuming right now, is quite a lot. And your wheat has also evolved over a period of time because of GMO, because of hybridization. Right? So to answer to that question, I would not recommend you to stop doing anything, but unless you have those symptoms. What are those symptoms? I'll come to that, right? So these are a few things that you should be very mindful of. These are very common, right? Thyroid problem. If you have a thyroid problem, you have to get your antibodies test. If you have a thyroid problem, you're gaining weight, that is Hashimoto's. If you have a thyroid problem, you're losing weight, that is Graves' disease. So you have to get your antibodies tested. So these are the foods that could probably trigger, especially GMO, especially hybrid ones. Right? Wheat could be a problem, barley could be a problem, dairy could be a problem. So you have to get to the bottom. You have rheumatoid arthritis. There is respective antibodies. We learned what is antibodies. That is what is tagging your healthy cells. So you can actually measure how much of a damage, how much of an antibody, how much of an inflammation that is happening in your body right now. So these are certain common diseases. There are more than hundreds of autoimmune diseases, right? But here are some symptoms if you want to take a screenshot. If you're gaining weight, have you done your blood test? Do you have a thyroid? Do you have any other problem? Do you have inflammation in your body? Then you go for an antibody test. Any of these. It could be in your family. I mean, you learned this. Can you pass this knowledge to your family? Hey, if you have a thyroid, have you done your antibody test? A lot of your parents, a lot of your siblings, a lot of people have thyroid, but have they bottomed out if it is autoimmune or something else? That is something that can be done only through an antibody test. So how to maintain a healthy gut? So gut plays a crucial role, right? We talked about for an autoimmune condition, for what not, right? Here are some tips, right? Say no to processed food, right? It's a common tip, right? Lots of fiber into your body. That is how your short chain fatty acids kicks in, and it helps you heal a lot of aspects in your life. Stress. There's a lot of research how stress impacts your gut. In fact, IBD, the trigger is stress. All the IBD diseases, the trigger has been stress, right? So choose a high quality animal protein, animal foods that you are consuming. If you're consuming any meat, we would recommend grass-fed. We would recommend you to consume organically grass-fed meats and eggs, free-range eggs, right? So eat quality plant-based foods, right? And antibiotics should be reduced as much as possible. The problem in India is antibiotics is available over the counter. You can just go and ask, they will give you. I was in UK, you need a doctor's prescription to buy an antibiotic. In India, it's not the case. You can go and buy, right? Alcohol, smoking, sleep also plays a crucial role, right? Stay away from these enemies: ultra processed food, sugar, refined oil, and alcohol, right? And increase your probiotics and prebiotics. So what is the difference? So probiotic will have a live microbe in it. For example, your curd has a lot of bacteria in it. It is live. So that is a probiotic. You have to consume more of yogurt, more of even pickle is a very good probiotic because it has a live bacteria in it, right? Also include prebiotics, which actually feeds your bacteria, which actually feeds your probiotics, right? Good fiber from your food, from your fermented food, right? I have listed for you here, right? Please include, it can help you, right? So nourish your gut with the right foods, and your bacteria inside your gut will say thank you. That's all I have to share. I hope it was valuable, right? Back to Yogi.